Okay, so today I'm going to be inserting a nasogastric tube in our patient Tran Nguyen. So before doing any of that, I would double check the order. So I see in the MAR, it's a nasogastric tube order for low intermittent suction for a suspected paralytic ileus, suspected post-op paralytic ileus. So I would check my order with the MAR. Everything looks good. I have the right patient. It looks like he has an allergy to silk tape. And so in this instance, I'm using non-silk tape. And so I would gather all my supplies. So I have my lubricant, I have the nasogastric tube and my syringe, and I have my pH strip, and I have my pin to pin to the gown, towel, basin. I have my tongue depressor, pen light, and alcohol swab. So I have all of these. I would take them to the patient's room. I would knock on the door. Hello, Mr. Nguyen. Today we're going to be inserting a nasogastric tube because we suspect that you might have a paralytic ileus. And so basically what that means is after abdominal surgery, sometimes your intestines will, they'll stop doing the movement that they need to in order to get food from your mouth to your rectum. So that's why you have some abdominal distension and some discomfort. And so basically what the nasogastric tube is going to do is it's going to pull out those, with the low intermittent suction, it's going to pull out those contents so that we can relieve some of that discomfort and get the, it decompresses to get that, to get your intestines moving again correctly. So do you have any questions before we start?
No, I'm ready.
Okay, can I verify your allergies?
I have no allergies.
Well, you're allergic to silk tape, but that's okay because
sorry.
it's in the
I'm
morning.
allergic
That's
to
okay.
silk tape.
You're in the hospital. It's a new environment. It's hard to remember. So we verified that, and then I would verify on the wristband that we have our correct patient, which is Tran Nguyen. I would verify his date of birth with the MAR, and it looks like those are correct, so we can proceed. So first I'm going to wash my hands. And I'm going to put on my gloves. And then for the purpose of the video, I'm just going to set up my nares here. Or actually first, before we do that, I'm going to check, make sure that the gag reflex is present with my tongue depressor. So go ahead and open up for me. And then I would poke the uvula with my tongue depressor. And because I'm using a metal knife and not a tongue depressor, I'm not actually going to do it. But I would make sure that there's gag reflex. Gag reflex is there, so we're good to go. And then I'm going to get my fake nares set up here. Oh, sorry. Thank you. Okay, perfect. Does that feel okay? Okay. So then, before we start, I'm going to check the nares for patency. So I would shine my pen light, look and see, make sure there aren't any obstructions, nothing that would get in the way of putting the tube down there. I don't see anything. Another way to verify too would be to ask the patient to hold, you don't have to do this, but to hold one side, breathe in, breathe out. And then get that to the other side, and then whichever one is more patent, whichever one feels more patent, we would go with that side. For the purpose of this video, it's going to be the right nares that I'm going to insert the tube into. So I would also cover with a towel, make sure that the patient's at least 30 degrees, and that's just in case, you know, there's any vomiting or any gastric contents, and we don't want it to get on the bed. So that's what the towel's for. And then I would let the patient know that the procedure is very uncomfortable in general, but if at any point he has a hard time breathing, or there are any problems, or it's just really, it's like uncomfortable to the point where it's unbearable, I would tell him to lift up his hand or lift up a finger to let me know to stop. So go ahead and do that if it's uncomfortable. And then I would hand the basin and then the water with the straw. And then I would instruct the patient that as I'm inserting the tube, so first, when I first insert the tube, when it hits the back of the throat, I would tell them when it hits the back of the throat to bend their head forward And then as I'm pushing it down, they would go ahead and take sips of the water to help guide the tube down. So first, before we get started here, I'm going to measure my tubing. So we start with from the tip of the nose to the ear, hold it, and then from the ear to the xiphoid process, which is where the ribs meet, and then a couple inches below, so right about there. And I would mark it with tape so that I know where to stop. Okay. And then I already have my syringe ready to go with the air, 30 cc's of air to do my whoosh test. And I would I would use my lubricant, make a little pile here to tip or put the tip of the tubing into to aid with inserting. So I have my tape ready, so I know where to stop, and then I think we're good to go. So I'm going to go ahead and insert it. Remember to let me know if it's uncomfortable. You can actually, bend your head back, and then once you feel it hit the back of your throat, go ahead and bend your head forward a bit. No, forward. Good job. And then go ahead and take some sips of water. Take some sips of water. Take some sips of water. You doing okay?
Mm-hmm.
Okay. All right, we're all done. Good job. So I'm gonna take this, unless you want some more, but I'm gonna take that. And so we've reached the end of our tape here. So then before we tape or do anything, we're gonna do our first test. We're gonna do our first test and listen for bubbling in the stomach. Okay, so I hear bubbling, which is good. And then I would aspirate, so I would pull out some gastric contents here, put that off to the side, and then I would cap. I would use my cap. We're gonna pretend like this is a cap, even though I know that that's what you attach to the intimate section. And then this is about what the gastric contents would look like. It's a green color. I know that the pH of gastric contents is usually between 4 and 5. So I would take my gastric contents and do a little bit. And then I would test the pH with my pH strip and whatever system that they use to match it. And I see that the pH is 4.2. So we'll go with that. So we have confirmation that we're in the stomach, but we would have to also get confirmation with an x-ray that it's in the right spot. And so that it looks like all of our bases are covered, our patient can breathe, he's doing okay. So then we can go ahead and tape. Oh, I would also, I would check the back of the throat to make sure that, just put that in there, no. I would check the back of the throat to make sure that I could actually see the tubing in the back of the patient's throat, because sometimes, especially if you have an unconscious patient with their mouth closed, sometimes the tubing can actually coil up within the mouth, and so you want to make sure that, but I mean, we have our proof from our gastric contents, so we're good there. But so then I'm going to go ahead and wipe off the nose with an alcohol swab and attach with our chevron tape. And it's going to be kind of funky because we're not actually we're just doing this demonstration video, but I would attach it, loop it around, like that, and then loop it around and attach like that. And because we're not actually using an alcohol swab, it's not staying very well, but in real life it would, hopefully. So it's attached with the tape, and then I would safety pin, give it a little bit of slack, safety pin to patient's gown. Okay. And then I would attach to low intermittent suction as ordered, and that's what this little piece is for here, that little piece that comes in the kit. So this allows it to attach properly to the intermittent suction. And then I would clean up my area, make sure the patient's doing okay, check the 4 P's, so pain, potty, possessions, positioning, and pain, potty, positioning. Oh, I forgot this last time. Pain, potty, positioning, possessions, all 4. Yeah, got it. Make sure the bed's low and locked, make sure the call light's within reach, and I would document, do all the documentation that's necessary, make sure that the x-ray came back, and that we were in the right spot in the stomach, and clean up the environment, and we're good to go.
Done?
Yep.